Okay, hello everybody, and welcome to this new episode of Ask Stago, the podcast from Stago. This platform is dedicated to answer the questions that you may have about our products or hemostasis in general. My name is Lisa Gannon and I'm Global Product Manager here at Stago, and I'm so glad to join you today. To animate today's session, I'm joined by Anne-Cécile Ortega, also Product Line Manager at Stago for Lab Automation Solutions. Hi Anne-Cécile.
Hi Lisa.
So today we're going to discuss a very specialised topic, a fibrin monomer, and we'll cover the basics and indeed what their clinical utility is in practice.
Yes, Lisa. And to cover the topic with us, we are glad to welcome Dr. Refaai. Dr. Refaai, it's a pleasure to have you with us. Dr. Refaai, you join us from the University of Rochester Medical Center in New York, where you're a professor of pathology and laboratory medicine. At Strong Memorial Hospital, you serve as a director of the Thrombosis and Hemostasis Lab and the associate director of the Blood Bank and Transfusion Medicine Department and the Clinical Laboratory Department. You also hold an appointment as an associate director of the Therapeutic Apheresis Unit in the Internal Medicine and Hematology Department. You're a member of several professional societies, and you are a board member of the Society for the Advancement of Patient Blood Management and the Bloodless Medicine and Surgery Society. You have published extensively, not least on the topic of fibrin monomer, which is why we are thrilled to have you here with us today.
So to start off, can we cover the basics? Could you discuss briefly the formation and function of FM in vivo?
Yes, hello everyone, and thanks for having me. Before I talk about this, I just want to clarify the methods how fibrin monomers, or FM we can call them, how do they form in normal hemostasis. I can refer to one of my paper about the FM clinical significance that was published in Thrombosis and Hemostasis Journal back in 2018. And there's a very nice figure actually to explain the methods of forming the fibrin monomers. So in normal hemostasis, usually 3 steps have to happen simultaneously in order for the body to stop the bleeding. And it happens in a very rapid fashion. That include number 1 is the vasoconstriction of the vessel where the injury happens, and then the generation of the platelet block, we call it, or platelet clot, which is consistent of the von Willebrand molecule and the platelets, and that's known as primary hemostasis. This will provide the surface membrane that's rich in phospholipid layers of the platelet membrane to activate the coagulation factors, which is the secondary hemostasis. And that's why we call it primary and secondary. So you need that membrane. Then on this membrane, all the coagulation factors are going to get activated simultaneously. And the end product of this will be the fibrin clot, where we form the clot and stop the bleeding. So this is in normal hemostasis. Now, this fibrin clot, then it will be as a mesh that will be cross-linked together with by the effect of factor 13, and that will make the clot stable and strong. Now, if we go back to that figure, and you can see at the top of that figure, at the top bar, that's on page 2 of this publication. Actually, on the journal, it was 2018 Thrombosis and Hemostasis, volume 118, and the page is 1857. So in this, on the top portion of this graph, you can see that the thrombin, which is a key factor or a key protease protein of the coagulation system, plays significant role in the formation of the fibrin monomers. The thrombin release or cleaves of fibrinopeptides A and B of the fibrinogen molecule. So it's still fibrinogen because it's not active yet. Once thrombin relieve these two fibrinopeptides A and B, then the fibrin monomers will form. So the fibrin monomers, basically, it's a step right after the activation of thrombin, the activation of thrombin to the fibrinogen molecule, so factor 2 to factor 1. And this fibrin monomers then, together with multiple fibrin monomers, they're going to cross-link together and form the fibrin polymers. Now, this also happened by indirect activation of thrombin through factor 13. So thrombin will activate also factor 13, will cause this cross-linking bonds between the fibrin monomers, forming the fibrin polymers. And in this case, you see there's like a very short window where it's before we form the clot, there's higher concentrations of the fibrin monomers. So there where the fibrin monomers come from. It's a step between the activation of fibrinogen and then the activation of factor 13 to cause this fibrin polymers to become a fibrin clot.
Okay, so based on that then, what would you say the clinical significance would be in practice, and what could be the potential clinical applications of the fibrin monomer assay?
Well, definitely we have an assay. Stago has one of these assays that can measure fibrin monomers, and during the years before my publications and also even after that, we were able to publish a lot of data showing that clinically fibrin monomers can be used clinically. And it's some of these studies show significant use of it. Some of them were like neutral about it, and some of them were like negative about it. But the most publications we saw were very positive about using fibrin monomers for clinical indications. So it was used very strongly in the IC, for example, and it was used also in the VTE. In cancer was a significant uses of fibrin monomers. There's a lot of publications. I can go through them. It will take a longer time than this podcast, but you can definitely see it in that same paper I'm talking about. Some positive and negative outcomes came also from strokes and from AFib, for example, acute MI, in pregnancy. Some publications also show there is a significant usage of fibrin monomers in pregnancies. So there's a lot of data out there indicating that fibrin monomers could be a good marker of possible thrombotic risk in patients which are hyperthrombotic or procoagulant cases that will indicate the formation of the clot before we even detect that clot.
And since the COVID pandemic, is there any new emerging research with COVID patients showing a value for using FM, for example, in an extreme inflammatory state?
I would say there was a lot of studies happened after the COVID era. I'm not aware, to be honest with you, if there's any recent publication about using FM in COVID, but definitely all of us know that COVID was a prothrombotic condition of these patients who got infected with COVID. So I'm assuming that if somebody would do such a study on most likely stored samples would be for now, they may find some significant outcomes of the prediction of the procoagulant condition in these patients, because everybody knows that's a lot of patients who actually died of COVID. They were like prothrombotic and they died by thrombosis. So maybe that will be, I mean, according to what I explained about the formation of M, I think that will be a very good marker to identify these patients who are at high risk, and then maybe start the anticoagulation a little bit earlier stages and save some of these patients.
Thanks. And Dr. Refaai, do you have any other pertinent point that you would like our listener to keep in mind?
I mean, to be honest with you, even since I published that paper and until now, I don't see a lot of prospective studies. I mean, I think it's very important to have clinical trials, prospective clinical trials on certain patients' populations that they are at high risk for thrombosis, or we know that they are will form clots. I would say if we do such studies, even on a small scale, and then maybe going to a bigger scale or different patient population, multi-center studies, I think all of this will help us increase the utilization of fibrin monomers in clinical cases. And if we increase the predictive value of this test, I'm very sure, and I will be the first one to bring it into my lab and to use it in my clinical, because obviously it will indicate for me where should I start the anticoagulation, where should I pay attention to the patients that's at high risk for thrombosis. So definitely more clinical trials are really needed in this.
And thank you so much for this very informative, brief conversation about this potentially very high value marker. And I think we can all say that we've learned a lot about the potential clinical applications that could be used for fibrin monomer. So thanks for joining us for our podcast, and indeed thanks to our listeners. As usual, all literature sources and links to previous podcasts are listed in the podcast description. And please feel free to send us any questions to ask@stago.com, and we'll be really happy to address some questions in our following episodes.
This podcast is brought to you by Stago. Diagnostics is in our blood.